Welcome to What's Now, a show where we focus on what you need to know all about healthcare, what's trending, great recent products, shows you need to watch, and much more. Today's episode is all about your health and also some fabulous reality shows, one that is unique and one that is returning. Up first, though, we are going to talk about a rare disorder. What would you do if your child was diagnosed with one? Well, I recently spoke with a nurse who became a nurse to care for her child and also a physician, all about AADC deficiency.
Her child was diagnosed with an ultra-rare disorder. Well, Kelly Heger became medical training she needed to care for her daughter Jillian at home. Jillian has a condition called aromatic l-amino acid decarboxylase deficiency, or AADC deficiency for short. And today, Kelly is an advocate for families coping with AADC. Kelly Heger joins us now along with Dr. Irina Anselm, a neurologist at Boston Children's Hospital. Thank you, both of you, for being here today.
Thank you for having us.
Dr. Anselm, what exactly is AADC deficiency? And what does the acronym stand for, and how is it pronounced?
This acronym stands for aromatic l-amino acid decarboxylase deficiency, but we always call it AADC deficiency for simplicity. This is a rare genetic condition that affects people all over the world, and it's a very, very serious disease, devastating condition that may end with early death.
And Kelly, you've gone through an incredible and awe-inspiring experience surrounding your daughter's diagnosis. Tell us more about that.
When my daughter Jillian was born, we brought home what we thought was a healthy baby girl, but sadly that was not the case. And Jillian was sleeping 23 out of 24 hours a day. She was floppy in my arms, very listless, and yet she held her hands fisted. She couldn't open them, and she couldn't open her eyes. But right around 3 months of age, she started having episodes of oculogeric crises. And this is a key feature. It kind of happens late in the afternoon, whether it be daily or every other day. But my daughter would experience these episodes. Simultaneously, she'd have abnormal dystonic posturing of her limbs. She'd get really rigid and twist in abnormal ways. Her face got dystonic, and she had, tongue thrusting, difficulty breathing. She had stridorous type breathing. She couldn't control her saliva in her mouth. She was choking on it. She was extremely inconsolable, crying, uncomfortable, and she'd have low blood pressure and sometimes even stop breathing. And so that's what led us to our diagnosis of AADC, and she was diagnosed the 4th child in the world.
Oh, what a terrifying experience. Dr. Anselm, what is most important for people to know about this rare disorder?
Well, the disorder is rare, but there are still patients who have this condition and who did not receive an appropriate diagnosis. Many of these children are diagnosed with cerebral palsy. Some are diagnosed with seizure disorder, epilepsy, because they have this oculogeric crisis that Kelly mentioned, and they may look exactly like seizures, and these children do not respond to treatment. So we encourage the families to talk to their doctors and to question if their children may have this devastating condition. And we want to refer everyone to a website about aadc.com, where a lot of information about this condition could be found.
And Kelly, tell us more about your advocacy efforts.
So I started a foundation, AADC Family Network, and I also have a website, aadcfamilynetwork.org. And in collaboration with PTC Therapeutics, we are bringing awareness around the globe. And we're helping families who are struggling with this disease and feeling so alone and isolated. A lot of these families could be the only child in their country with the disease, and they don't know where to turn, where to go for questions, where to get those answers. And so the foundation is helping by giving them a place to find, to have access to.
Dr. Anselm, what is the most important takeaway that you want us to know?
Just talk to your doctor if you're uncertain about diagnosis that your child has. Child may have this AADC deficiency, and if diagnosed, can be treated in a correct way.
Well, thank you so much, Dr. Anselm and Kelly, for joining us today. I really appreciate this important information about AADC deficiency. And Kelly, really brave to share your story, and I hope your daughter is doing well, and we appreciate all of your advocacy with this. Thanks so much for joining us today.
Thank you so much.